high-level steering meeting on the AU-EU Partnership on Health is being convened today in Pretoria, the capital city of South Africa. It is a 25-year-old partnership built on fighting diseases like Mpox, but has also been a strong coordinated voice on global health initiatives. The meeting is coming ahead of the G20 ministers meeting in South Africa this week. Our key results of this collaboration include the procurement and donation of 215,000 vaccine doses to support Africa Center for Disease Control, addressing the Mpox outbreak in Africa. And to speak to us further on this gathering, we are joined on the line by the Director General of the Africa Centers for Disease Control and Prevention, Dr. Jean Kaseya. Dr. Jean, good afternoon, and thank you for joining us on Africa Update.
Thank you, Lulu, for having me.
Now, take us through some of the key issues that will be discussed in this meeting.
Yes, this is the fourth time we are meeting under this partnership we call AU-EU Health Partnership. And we decided to be in South Africa because, as you said, South Africa is home to the G20. And for the first time, number of Africans like myself, we are seeing an African country hosting the G20. Yes, today conclusions will go to the G20 ministerial meeting that will take place from tomorrow in Polokwane, then to the presidential G20 meetings, but also we have the AU-EU summit that will take place immediately after G20 in Luanda. It means it's a major momentum that we are celebrating in our partnership with AU-EU.
Now, we understand one of the topics is about vaccines and how is Africa doing in terms of manufacturing its own vaccines since the COVID-19 pandemic.
We need to give credit to our friends from EU because this agenda of local manufacturing of vaccine started also with the main support that we got from EU under what they call the MAF Plus initiative, supporting manufacturers in South Africa, in Senegal, in Rwanda, and so many other countries. Currently, we are discussing how to move forward now that Africa has a strong Africa CDC with the African pool procurement mechanism that will create, the market we are talking about. And we also have a strong African Medicine Agency that will be the regulatory aspect. We are trying to see how effectively we can build our partnership around these two mechanisms to make sure that this agenda of local manufacturing of vaccines, but also other health products, becomes a reality in Africa.
On Monday, Jean, the Global Council released a report about pandemic inequality, which affects poor countries, mainly on the African continent. What are the plans of the Africa CDC in dealing with that? And will the meeting that you are having with the tackle that as they present mostly the rich countries? They represent, rather.
It's not just the vaccine inequality or inequity. It's almost the inequity to access all medical commodities. Africa is reporting more than 250 outbreaks per year. It means almost a new outbreak every day or every 2 days. And one of the major concerns that we have when we have an outbreak, where are we getting vaccines, medicines, diagnostics? For Mpox, we got support from European Union, as you said in the introductory remarks. But we don't want to be dependent on donation. We want to manufacture our own product. This is why, to reverse this narrative, to have Africa being well protected, to better protect the world, we are making sure that this agenda of local manufacturing is moving. Currently, we already identify not less than 547 manufacturers and around 25 of them on vaccine. Things are moving in Africa. As Africans, we need to believe on that, and we need to buy African product. This is our message today to our people and our leaders.
Just speaking of these 547 manufacturers, with 25 focusing mainly on vaccines, just highlight some of these, manufacturers of the vaccines, and which parts of the African continent are they coming from?
They are coming from all regions of Africa. Yes, there are countries that are more advanced, like South Africa is one of the countries more advanced. But I can assure you, today what I see is a vibrant Africa. And when we talk about local manufacturing, we talk about the end-to-end development. It means there are countries like Tunisia mostly focusing on research and development. And they are also part of these dynamics we are talking about. And I have to ensure you that when people are coming, and this is something critical for us, you can hear people saying there are so many manufacturers in Africa. This is not true, because we have 1.4 billion people. If we compare with India and China, China has 1.4 billion people. India has 1.4 billion people. But in China, you have around 5,000 manufacturers. In India, you have more than 10,000 manufacturers. It means there is still room for improvement and growth in Africa, but our role is to avoid unnecessary competition between countries and between manufacturers. This is why we have a kind of mapping. We can manufacture what and where to avoid this competition. Let me tell you, currently, what we are manufacturing in Africa is really attracting investors and is building confidence on our communities that we can start to use African product, because it's also a quality assured product.
Another topical issue, Jean, is the lenacapavir, the long-acting injectable antiretroviral drug. What are the discussions with regards to this on the continent?
Yes, first let me celebrate that, and let me congratulate the South African government to authorize this drug to be used. But as I was saying, nothing is magical. We need the transfer of technology for this product to be manufactured in Africa. We are calling our partners to facilitate that. In South Africa, in Egypt, in Morocco, in so many other countries, we are able to manufacture this product. And we are able even to reduce the costs if we consider the volume, number of people who can get access to this product. Why mostly Africa that is affected for HIV, this product must come from other continents. I think this is the discussion that we are opening, and I think we'll win one day.
Now, Jean, because of time, I have to just wrap this up quickly. But what are the pressing health concerns on the African continent that you would want the G20 summit and health ministers meeting to tackle?
Currently, we are promoting the concept of health security and sovereignty. First, we want African countries to start to contribute to put more domestic resources. Second, we want African countries to start to lead the agenda of local manufacturing and to use the African pool procurement mechanism. Third, we need the digital transformation agenda to make sure that all communities and our systems are connected. Fourth, we need to see more reform at global level, with the regional and country levels being more prominent. I think this is the critical message that we are bringing to the G20.
Well, Jean, we have run out of time. I wish we could have gone further, because one thing I'd like to know is, at some point, is Africa going to be, supplying the rest of the world when it comes to medicines and vaccinations, apart from research and development?
Yes, and yes. That one, before maybe you and I will leave this world, it will happen.
All right, John, we'll leave it there for today. Thank you for joining us on Africa Update. That was the Director General of the Africa Centers for Disease Control and Prevention, the Africa CDC, Dr. Jean Kaseya, speaking to us.